It won't just be people traveling for the holidays. The Omicron variant might well be too. New numbers show it's spreading fast. So what can we do to slow it down?
Joining us to talk more about the latest and answer some of the questions that you're likely asking yourself right now is Dr. Allison Arwady. Thank you so much for coming on the show today.
Thanks for having me.
All right, well, let's start with this. Omicron, of course, sweeping the U.S. at a quicker pace than Delta did. Chicago at an 8.3% positivity rate last week. It was at 4.2%. Over 16,000 new cases just yesterday in Illinois. I mean, how contagious is this, and what do we know?
Yeah, it is really contagious. It's probably in the range of 3 times as contagious as Delta was. That itself was more contagious than the original. And so it means you don't have to be exposed to as many viral particles to potentially be infected. This is why it is spreading so quickly. We broke our record for the calendar year yesterday here in Chicago, and I think we're going to break our all-time record for cases soon.
Doctor, hospitals are saying they are now seeing more breakthrough infections too because of Omicron. I hate to put it this way, but is it inevitable we are all eventually going to get this vaccinated or not?
So here's what we're seeing. We are definitely seeing more breakthrough infections with Omicron, but especially people who are not only vaccinated but boosted. We're seeing a lot of mild infection in those folks. We're not seeing people getting seriously ill for the most part. But I want people to hear that while the folks are going to the hospital, most of those people remain unvaccinated, unboosted. And right now in the hospital in Chicago, even just since yesterday, we had another about 200 people get admitted with COVID, almost all of them still unvaccinated.
Well, the president said this week that fully vaccinated people can still safely celebrate the holidays and that they don't need to cancel plans or gatherings. What is your position on that? Do you agree? And if so, what steps can people take to stay safe if they're going to have family and friends over for Christmas?
Yeah, it's a great question. So I'll tell you what we're doing in my family. Everybody who is going to be gathering is not only fully vaccinated, but boosted. And let me just emphasize, especially if you're depending on a J&J vaccine from months and months ago, you've got to get a booster shot. So vaccine and booster, if everybody's done that, that's the most important part. I think right here in Chicago and Illinois, right when we're at this peak moment, if people are able to add some additional testing to that, do one of those at-home tests even before gathering, that's going to make it safer. But I agree, time with grandparents, time with family, these traditions are important. The reason why we can have such very, very high case rates without yet seeing the hospitals totally overwhelmed is because of the vaccine. And so where people have done that full vaccinating and boosting, being careful, not taking too many unnecessary risks right now, I am in favor and do support those more careful gatherings at the holidays. And I'll be doing that with my own family.
Well, I'm sure you've been asked this time and time again, how long before Omicron runs its course? Do we expect the next few months to be bad?
So I certainly expect the next month or two to be bad. Yes. Again, when I say bad, I'm mostly worried about people who haven't had their vaccine or haven't had their booster. But we have more than 600,000 people in the city of Chicago who still have not had either a vaccine or have any proof in their blood that they even had COVID in the past. And we're seeing that people who are also trying to depend on, I had COVID 6 months ago, Omicron doesn't care. Like, people are getting reinfected with that too. And so I am concerned, of course. This is part of why we put that requirement in place starting in January, that in the certain high-risk public places like restaurants and bars, entertainment places where folks are going and food or drink are being served, you're going to need to be vaccinated to come in. That's to try to keep those spaces open, to try to keep people as safe and the employees as possible. But it's folks who aren't vaccinated. I know people have heard this over and over again, but it is more true than ever. That's who's going to the hospital. That predominantly is who's dying from COVID. And I just don't want COVID to impact, your holiday celebration. So that's the most important thing. But yeah, we're worried. It would be wrong not to be looking at what's going on right here and around the country.
I know you look also at what's going on around the world, and we've been reporting today that the cases in South Africa where this didn't originate, but they found it there and they had an explosion, that they're starting to see their numbers come down. Is that giving you some hope?
It's giving me some hope for sure. The fact that this is so fast moving, it took months for Delta to become the predominant variant, both in South Africa, here in Chicago, here in the US. We saw that happen in a matter of days in South Africa, and we saw it happen in a matter of days here in Chicago and across the US. Just, less than 3 weeks ago, fewer than 1% of our cases in Chicago were Omicron. Right now, it's the majority. So this thing is moving very fast, and certainly our hope is that it will come through relatively quickly and come back down. But the worry is, again, if you're not vaccinated, the risk of you getting Omicron is extremely high. If you're not boosted, the risk is also much, much higher. And we're even going to see some breakthroughs in folks who have been boosted. But the ones going to the hospital, the ones getting sick, are the ones who still haven't gotten that vaccine. And my biggest worry is, even if this peak goes relatively quickly, it is putting a lot of people in the hospital. And we've got to make sure we don't overwhelm our health system. We've seen the National Guard have to go into hospitals already in Wisconsin and Indiana and Michigan. It's not a good situation if we have to stop, doing some of the other things that hospitals can do. So I like a potentially quick surge, but I worry about it because it can hit hospitals all at once. And that's why we're asking people to be extra cautious. Keep those masks on. Just do what you can while we get through this hopefully not too long, but really bad surge. And most important, just get that vaccine and get that booster.
All the steps we should all be very familiar with at this point. Before we let you go, we're almost out of time. I had to ask you about the new proof of vaccination mandate in Chicago. Starts at the top of the year. Has it been shown that doing that will stop the spread?
So what we've seen is that in cities, and many cities around the country have done similar things, we see it drive vaccination quite a bit. So a lot of people who maybe were holding out, they want to be able to go to a restaurant. They want to be able to do some of these fun things, particularly in Chicago. There's a lot of nice entertainment options. And so we see it affect people's decision to get vaccinated. And absolutely, these are the riskiest places. These are the places where folks are sitting down, taking off masks, or in settings where we've seen significant outbreaks. And so we do not want to shut things down. We do not want to have to put capacity limits in place. I went to the Nutcracker yesterday with my 6-year-old niece. We were all showing our vaccine cards. Everybody was wearing masks, even the dancers. I know it's a little different than normal, but we loved it. And the ability to do some of these things that help keep these settings and traditions we love safer is what we're going to want to do. And so if you've not started, to do some of these fun things, not essential things, but fun things, you're going to have to be vaccinated starting right, as you said, January 3rd. If you haven't started, start now so you can join the fun soon.
All right, Dr. Allison Arwady, thank you so much for coming on the show today.
Thank you. Happy holidays.
Merry Christmas.
Same to you.